Good morning, all of you. How are you? Fine, ma'am.
Good morning. How are you
Good
all?
morning, ma'am.
Okay. So any doubt from the previous session? We have done about. Let me check the slides also. Okay, so we did about echocardiogram and cardiomyopathy and Holter monitor also. Okay, so I'll just open it quickly. Just a minute. Okay, echo in heart disease, we have done echo for cardiac function. Okay, Holters you are doing, ECG stream Holters. Echocardiography also we have done. Principles of Holter and utility and indications. Just a minute, let me just. Okay, principle of Holter we have to do, and then we have to do utility and indications, and also analysis of Holter. So the last slide which we discussed in the previous class was regarding the Holter, ECG Holter, stream Holter. Okay, and in that we discussed that it is a portable ECG which records the electrical activity of the heart continuously over 24 hours of time. And also we learned about data storage, how data is stored in Holter. Okay, then we have to understand now the utility and indications. Okay. Utility and indications of Holter. So the first name, the person name was Dr. Norman Holter, and in his name only the whole Holter principle came. Dr. Norman Holter. He was the one who introduced portable devices. Portable devices to record the ECG in 1957. So besides Holter, we have event monitors, ambulance monitors are there, and then the ECG patches, which we have already learned. Okay, now how this Holter monitor works. We have already seen in the previous class where I drew that diagram of a man wearing a Holter monitor, remember?
Yes, ma'am.
Okay, so in that, now the Holter monitor, the screen of Holter, it is small, like this. This is the screen area, okay? So it looks like this. The front area, screen area, it is small and it's slightly larger than a deck of playing cards. There are a lot of wires, leads, several leads or wires are attached to the monitor. And the leads connect to electrodes that are placed on the skin of chest with a glue-like gel. There is a glue-like gel which is applied on the chest of the person to which Holter ECG has to be attached. Right, I'm going to the next slide. The metal electrodes conduct heart's activity through the wires and into the Holter monitor. Where it's recorded. The uses are for those patients who experience daily symptoms. Patients experiencing daily symptoms and precise quantification of arrhythmias. Next, the advantages. Advantages are 24 to 48 hours full disclosure available. That means we can record what has happened to heart in 1 day or 2 day recording we can do through this monitor. Heart rate is monitored and arrhythmia counts. Example, 10 PVCs per hour. Okay. Now for patient preparation, I'm going to the next slide. First step is the skin of the patient has to be prepared for electrodes. Prepare skin for the electrodes. And that person has to wear the monitor every time until at least 24 hours or 48 hours every day for the entire length of the prescribed procedure. And he has to do all the normal activities. Obviously he has to be more careful while using water, otherwise he can never remove that halter for at least 1 day. Always wear the monitor, doing all the daily jobs, doing all normal daily activities. But has to make sure that any part of the monitor does not get wet. Part of the monitor do not get wet. Next is you should record everything in a diary. For example, this 7 a.m. The monitor, the halter was attached, and then next day this I did this. So record everything in a diary so that it helps in analysis. Record your activities in a diary. Do not use instruments which have magnets or which can interfere with the working of ECG. For example, cell phone, MP3 players, electric blankets, microwaves. Including magnets, microwave, etc. And most important, follow instructions. Instructions are always provided in the user guide, which is given along with the instrument. Okay. So now I have to show you how a Holter ECG summary looks like. So I'll draw that. Shall I move on to the next slide?
Okay, ma'am.
Okay. So now we have to assume that this is a Holter ECG report. Holter ECG report summary. So it has divisions like this. One, so I think I should use black color. Okay, one, which includes the name of the patient, date and all, and then patient information a bit. I think this one has to be a little bit lower. Like this. Okay. Now the first thing is name. For example, my name. Phone. And then it will be written over here that this is a Holter ECG report of this person. Recording start date. And then age, weight, and other parameters, height, and doctor's name and all. Okay. Okay, next comes more details like, address and all. Address of the person, doctor's name. And indications, like what were the problems when you went to the doctor, medications. Okay, now the main part of the report. This main part has 6 boxes. So we'll draw the 6 boxes like this. One division and another division. Okay, so like this, we have 6 boxes, and I should in this 6 boxes, what do we measure? Heart rate here. We measure ventricular ectopy here. And we measure heart rate variability. In the lower ones, segment analysis, supraventricular ectopy, and bradycardia. Right? So under these come all those, so we'll ask the patient, or this will report in after every 4 intervals how many beats were there. So for example, it will report 47 beats per minute at 12:51 a.m. and then it will keep on going, for 24 hours, like 107 beats per minute at 120, 56 beats per minute at 2 p.m. like that. Right? And it will also show the graph at different like this. Significant ECG events will be recorded, like 1 and 2, 3, 4. Like this. And then there will be graphs. Some peaks will be there. So let's say 13. It is also recording the time. 1:53. At 1:53, this was the ECG. Okay. So in this way, it will do the recording randomly. For 12:30, assume that it is like this. Like this. Okay. So in this way, there will be 8 different graphs recorded at random timings so that we can analyze the results. Let's say this is 12:37. (13:21). Like this. So in this way, we have different graphs which will record the readings at different point of times, because the Holter monitor is always connected for at least 24 hours, and it will give us different ECGs at different random timings. Maybe it can be at a time when a person is exercising, can be at a time when a person is doing some household work, or it is sleeping. So because we have to make an average of how the heart of that person is working. Now, on the basis of the report, the graphs, the heart rate, ventricular ectopy, and all these factors, conclusions will be given. So, for example, the conclusion here is the heart rate, average heart rate, which was either recorded for 48 hours or 24 hours. The average heart rate for 24 hours was 65 beats per minute. The minimum heart rate was 47. At, let's say, any time, 12:51 p.m. And then we'll give the minimum heart rate also. That minimum heart rate was 107 at, the maximum heart rate was 107 at 1:20 p.m. Also, we'll inform about the pauses. You know, pause means when heart stops pumping. It should not be more than 1 or 2 seconds. Okay, so that will also be recorded. Pauses greater than 2.5 seconds were 2. Okay, and also we will analyze the graphs also. You know, for example, we'll say that supraventricular event, the supraventricular event here were 0. The readings were highly touching 65 or something like that. So on the basis of this, now we can conclude that the data is summarized like this. We have 6 boxes, 1, 2, 3, 4, 5, 6 boxes are there. First box is heart rate data. It records what was the heart rate of the body at different times in 24 hours. Okay. Ventricular ectopy records, remember R and T, PQRST we have in the ECG. So it records R and T. Okay. Third box records heart rate variability. That means the heart rate should remain stable all the time. It should not be too high or too low. And also it should not miss the beats. So that was recorded by heart rate variability. Next is supraventricular segment analysis. And this was supraventricular ectopy. So they tell us about the pauses. How many pauses were there in beats? Bradycardia event tells us about if the pauses were more than 2.5 seconds. That means if your heart stops pumping for at least 2.5 seconds, so that means it's bradycardia. It's missing beats, and it can lead to problems because your heart is pumping blood, and then it is pausing for 3 seconds, and that is risky. That is recorded by this bradycardia. And also at the end, mini ECG strips are given. You must have seen fax machines earlier, or maybe when you go to a phone booth, that bill is auto generated. So like that, ECG strips are auto generated after each event. Fine. Any doubt?
No, ma'am, no doubt.
Shall I move on?
Definitely, ma'am.
Now the 24-hour trend report. So either this report is for 24 hours or for 48 hours. That means if a patient goes to a doctor and complains that I am having difficulty breathing, or I am having difficulty in any difficulty which can be related to heart. So in that case, what will happen? The doctor will attach this Holter monitors to the person, and I will record the 24-hour trends. So, and at the end, that summary will come, the report, we just saw. So now the report indicates, it shows 24-hour trend of heartbeat, heart rate, supraventricular ectopy, and SNT recording. So all those 6 factors will be shown. The bottom half shows hourly counts for heart rate, or the trend also shows the hourly counts for heart rate, arrhythmia, pauses, and supraventricular events. So it will record how many times heart was beating in random hours. It will record, and on the basis of that, it will give us minimum beats per minute and maximum beats per minute. It also tells us whether there is a break, whether at any point heart stopped pumping more than 2 seconds. If the time is more than 2 seconds and heart is not pumping, that is counted as arrhythmia. Or if the pauses are more, pause means, in the heart, we have learned that there are 4 chambers in the heart, and blood goes from atrium to, like, for example, it starts from right atrium and it goes till the ventricles, and then the purified blood goes out from the ventricles and it is then distributed to the whole body. In that process, since it is moving from one chamber to another, so when it moves from one chamber to another, so there is a pause in each case, because there are walls in between, which we have learned. This is, for example, these are 4 chambers of heart. When blood flows from this to this and from this to this and like this, each time when it moves, crosses the border, there is a pause. This pause should not be of much time. Okay, if it is missing the beats or is pausing for more than required time, that is counted as arrhythmia and bradycardia. That means your heart has stopped pumping for 3 seconds, then that is not good. This can be recorded by a 24-hour trend using ECG Holter monitor. Okay, it also tells us about heartbeat in excess and the minimum heartbeat. Okay, please note this down. I'll be back in a minute. Fine? I'm coming back in a minute. Okay. So now we have to give the analysis of the Holter report. So the analysis, for example, there is some missing beats or something. So the doctors will, the technician will send the report to the doctor, and doctor will also analyze. So now in that case, go to the next slide. We have to summarize those arrhythmias that are not necessarily pathologic first. So we have to rule out which one is risky and which is not, which is normal. Arrhythmia means missing beats. Okay, so now when we say missing beats, you know, heart has a typical sound and has typical order of beating. So it beats like this: lub, dub, lub, dub, lub, dub. Arrhythmia means lub, dub, pause, lub, dub, pause. That should not be there. Okay. If these pauses are less in number, then it's okay. But if it is going more than 3 seconds, that means it is not good. So we have to rule out which is good, which is not good. First thing, that is called sinus bradycardia. Sinus bradycardia means during sleep or when a person is resting. During sleep or rest, when a person is in a relaxed state or the body is in a relaxed state, at that time there can be patterns which can miss the beats, but that is okay. Second is sinus arrhythmia with pauses less than 2.5 seconds. Sinoarterial exit block. Wandering arterial pacemaker. That pacemaker is a machine which is used in patients who cannot, who miss beats. So then a instrument is attached to their skin for whole life. You know, it is attached in the chest area. That is called pacemaker. If a person is on pacemaker already, then he has a chances to miss beats. Premature arterial or ventricular complexes. But then there can be some arrhythmias that are warning. That means they warn that there is some problem in the heart. Frequent and complex arterial and ventricular rhythm disturbances. Second degree arterioventricular block type 2. Third degree arterioventricular block. Sinus pauses longer than 2.5 seconds. Marked bradycardia during waking hours. So if a person is not sleeping and still he is missing heart rate, heartbeats, that should be awakening. It should be marked. Tachyarrhythmia. Tachyarrhythmia means pause during heartbeat. Okay. Shall I move on? Okay, next we have the role of Holter monitoring in patients with known heart disease. What is the role of Holter monitoring in patients with known ischemic heart disease? So now in a patient who has heart attack, in the post myocardial patient, a person who already suffered from heart attack in his life. Heart attack is also called myocardial infarction. Patient the occurrence of frequent beats more than 10 per hour and non-sustained ventricular tachycardia, it's also called VT, by 24-hour monitoring is, shall I go to the next slide?
Yes, ma'am.
Monitoring is associated with a 1.5 to 2-fold increase in death. Now, if we do not know whether a person has heart disease or not, but we are just suspecting, so diagnosis of suspected ischemic heart disease. First, transient ST segment depression. ST is that ECG PQRST. Okay, that ST segment depression. Depression means when graph goes down. When this graph goes down, that is called depression. Just a minute. Yeah. So depression means when the graph is going down. That is ST segment depression is 0.1 millivolt or greater for more than 30 seconds. Is rare in normal subjects. And correlates strongly with myocardial perfusion scans. That show regional ischemia. So now by seeing the graph and how that graph is going down, and also we can record by how many millivolts it is going down. So if this depression is more than 0.1 millivolt for more than 30 seconds, so that is normal. But if it is not, it is going down for more than 30 seconds, so that means that person has myocardial perfusion scan. That means it has some associated heart diseases. Although some monitors can detect and quantify ST segment changes. Okay, next is what is the role of Holter monitoring in case of a stroke, when a person is undergoing stroke? Role of Holter monitoring in stroke. So approximately 25% of stroke remains unexplained. We do not know the cause. Sometimes a person is perfectly fine and he suddenly gets a stroke. It remains unexplained after a thorough clinical evaluation and is labeled as cryptogenic. Occult arterial fibrillation is identified by ambulatory monitoring in approximately 3% to 8% of patients with cryptogenic stroke. Okay, so what next we have? ECG done, echocardiography, measurements of flows and gradients, or various assessment of. Okay. Next we will do stress echocardiography we have to do. Its protocols, 2D echo views, and analysis. So now echocardiography and stress echocardiography, they are different because in stress echocardiography, a person is put under stress. Okay, so a clinician wants to test when a person is put under stress, what is the effect of stress on patient's heart and how effectively patient's heart is able to respond to that stress. Okay, when we say stress, now what is stress? First of all, in this case, what we are referring to stress. Stress is when body is not in relaxed state. So this is part of the procedure. Okay, you must have seen people running on the what is that called? Those machines, you know, that is also called TMT. People run on that machine and they keep on running until they are sweating. So in this way, doctor wants to check what is the effect of stress on your heart and how effectively your heart is able to control or to regulate that stress. Any stimulus is something which is coming from outside and causing some changes inside. For example, a fear of anything, or pain that disturbs or interferes disturbs or interferes with the normal physiological equilibrium of an organism. Usually, to give stress, the person they're asked to run on a treadmill. Okay. So when a person runs on a treadmill, stress occurs, and it can lead to perfusion defect, that a person's heart will not be able to handle it, and it will show perfusion defect, and also changes in ECG. Now we have to choose which patients are appropriate for routine ECG test. So now patient who can exercise for 6 or more minutes, patients who do not have any history of diabetes, or they do not have any history of heart attack, myocardial infarction, and those patients who have normal baseline ECG and no history of any coronary revascularization, like any heart problem. Those patients are only given stress ECG. Let me just click picture of all these. Okay. So next we have to study uh, patients appropriate for routine ECG. Patients appropriate for routine stress ECG test. No history of diabetes. Patient can exercise for 6 or more minutes. No history of coronary revascularization, no history of myocardial infarction, normal normal baseline ECG, okay, so 2D eco view we have to see actually. Okay, first we have to see what happens in case of a heart disease so that we can check how stress ECG responds to it. This is called ischemia. Now in a ischemia cascade, it looks like this. It's like a graph. And has certain points 1 2 3 4. If it goes till this level, it shows angina. This shows ECG changes. This shows regional dysfunction echo. And flow heterogeneity. This is rate pressure product. Stress test stage. So now what heart diseases do? Ischemia induced effects on intracellular calcium and sodium levels. When there is excess of calcium, due to heart not working properly. Excess of calcium it leads to electrical instability, contractile dysfunction, ECG changes. So when there is mechanical dysfunction, which we can categorize as abnormal contraction and relaxation. Contraction and relaxation. Increase diastolic tension. Okay, anyhow. So due to this, what happens? Increase extravascular compression. And due to increase extravascular compression, decrease blood flow to microcirculation and decrease delivery to myocytes, which leads to low oxygen supply. This is increase oxygen consumption to maintain tonic contraction. And increase ATP hydrolysis. This leads to increase oxygen demand. Now comes the interpretation part. Okay, so we have to remove some slides. I'll remove them. Okay. Okay, so now what we have to do is to check. Advantages of stress echocardiography. Higher specificity, visualization of cardiac walls, evaluate for presence of pericardial effusion, yeah. Next is ability to measure RV systolic pressure, lower cost, and most important is there is no radiation exposure. Lack of radiation exposure. Okay. Let me see next what we have to do. So, after stress echocardiography, 2D echo views also we have to do. 2D. Okay. So we have to see now 2D echo. And M mode basic views. Okay, so there are right lateral decubitus, which includes congenital heart diseases, ascending aorta, aortic valve velocities, and right apical view shows us congenital heart diseases. Now, the things which we study in this, first is movement, second is tilting. Tilting means in which position the person is lying down. Third is angulation. Fourth is rotation. And I think I will send the images because I have to send the images as notes only, because I won't be able to draw them here. Because we have to see the heart in 2D view in two directions, so that we can see how the heart is working, whether it is working properly or not. In order to check that, we check heart in two directions. So I'll send you some echo images. Okay, what else do we have? In M mode, let me check. Yes, we have to see the images only. I have to share that with you. Because M mode scan shows angles like this. For example, if we assume that this is heart, okay, now there are various chambers of hearts. So we will assume each chamber as, for example, this is left atrium, this is left ventricle, right atrium, right ventricle, like this. And then we see the different views. So we are seeing the heart from different views. Let me see what other thing we have besides this. Cat lab. Uh, can you tell me the cat lab is cardiac catheterization only, right?
Yes, ma'am. Cardiac catheterization lab.
Is cath lab, right? Okay,
Yes,
so
ma'am.
yeah, we have to start then cardiac catheterization. And for this 2D echo, I'll send you some pictures which will make you understand the pictures, real pictures, which will show this image very properly.
Okay, ma'am.
Okay, so we will start with this cardiac. What about rest of the topics you have done, like physiology from the other teacher?
Yes, ma'am. Anatomy and physiology, another teacher done.
Okay. Where are your other friends?
Ma'am, maybe
Everybody has left. Boring class?
no, ma'am. It is important for us.
Yeah, that's true. It is important. Whatever it is, either boring, but it is important. So we have to learn cardiac catheterization procedure and diagnostic studies. So this cardiac catheterization, also called cardiac cath or heart cath,
Yes, ma'am.
cardiac cath, heart cath. It is a procedure that allows to see how well our blood vessels supply to our heart. Allows to see how well our blood vessels supply to the heart. During the test, they put a long, narrow tube called a catheter into a blood vessel. In the arm or leg and guide it to the heart with the help of special X-ray machine. And the contrast dye, so the dye which is colored, it can help to trace, how our heart is working. The contrast dye is injected into the blood vessels through the catheter to create X-ray videos of our valves. Valves are the linings between the two chambers of heart. Valves, coronary artery, and heart chambers. Right?
Yes, ma'am.
Okay, so now after this, so this was the procedure. Okay, the uses. So a very common example of cardiac catheterization is coronary catheterization, which is specifically for blood vessels, and it involves catheterization of coronary arteries for coronary heart artery diseases. A common example of cardiac catheterization is coronary catheterization that involves catheterization of the coronary arteries coronary artery diseases, coronary artery disease and myocardial infarctions. And myocardial infarctions, heart attacks. Okay, there is one more like this. It's called a coronary angiography. It's a diagnostic procedure that allows visualization of coronary vessels. It is done by using fluorescent material. You know what is fluorescent material? Fluorescent material is something when it is injected in our body, it will, it will brighten up, it will flourish if seen under a microscope or in a MRI. Okay.
Okay, ma'am.
So coronary angiography is a diagnostic procedure that allows visualization of the coronary vessels. And fluoroscopy is used to visualize the lumens of the arteries as a 2D projection. If the arteries show narrowing or blockage, then the techniques exist to open these arteries. So if in the results we are able to see that the arteries are blocked because the material is not able to flow further, you have injected a fluorescent material which is not able to flow further, that means there is some blockage. If arteries show narrowing, that means narrowing means normal arteries are like this, and if they are narrowed, they are like this. In this, blood is flowing properly. In this, the blood flow decreases. This is narrowing, and blocked is like this. Like this. So when it is blocked, there is no blood flow beyond this point. So if arteries show any of these symptoms, narrowing or blockage, then techniques exist to open these arteries. So there are a lot of technologies. You know what we do? Ballooning. In ballooning, we put a balloon like thick inside and try to open up this block. Or if we put a balloon inside here, it will widen up the artery. Or insertion of a stent, mechanical stents, which increases blood flow. Right? Are you done with this?
Yes, ma'am.
I just have to take a picture. Just a minute.
Okay, ma'am.
Stress choreography 2D. Eco and M mode. Catheterization.
Ma'am, last class echocardiography, color Doppler echocardiography slide are missing. Shahid bhai cannot get ours.
Which slide was that? Do you remember? What was drawn? What was written on the
Ma'am,
slide?
Doppler echocardiography and color Doppler echocardiography slide.
Let me note it down. Just a minute. Okay, I'll make the note. Okay, so where is my
Okay.
book? Just a minute. Okay, so today date is 23rd December. See, CVT. Okay, Doppler
Echocardiography and color Doppler echocardiography.
cardiography and color Doppler. Okay, I have to send you Doppler and color Doppler, and I will send you M mode 2D views, because those are pictures which I have to send you. So I'll send all
Yes,
these
yes, ma'am.
as notes before next class.
Okay, ma'am. Okay. Thank you.
Okay, so we Okay. Yes, sir. So I was discussing that now the techniques which are available that involve opening up the blocked arteries or vessels. So we call them
Yes.
percutaneous coronary intervention. So percutaneous coronary intervention, it is a blanket term which involves use of mechanical stents, balloons, etc. to increase blood flow to previously blocked or occluded vessels. Now the catheter like tube which is used in this, the catheters, they are fluid filled conduits that can transmit pressures to outside the body to pressure transducers. This allows measuring pressure in any part of the heart that a catheter can be included into. Okay, so we have to do therapeutic and interventional procedures also. Acquisition of cath data, acquisition of cath data pressures and waveforms, angiography techniques, cardiac catheterization, hardware, complications of cardiac catheterization. Okay, so only this much is left now. Learning about this.
Okay, ma'am.
Okay, so rest we will do in the next class then. Cardio catheterization.
Okay, ma'am.
One doubt. Can you tell me this? Cath
No, ma'am. No.
is BCVT 301 cardio catheterization. Are you doing this with someone else?
Ma'am, can you repeat?
There are two papers. Paper cardio catheterization paper. I asked. Don't worry. Okay. Okay then.
Okay,
We'll
ma'am.
meet in the next class.
Okay, ma'am.
I'm just taking the picture of this and giving you. Okay then, bye.
Okay, ma'am. Bye.